hello. I am Jenna Cantor. I'm with Eddie Ernst, and today we're talking about both the differences between physical therapists and physical therapy assistants, and then just how we can work together. So, Eddie, would you mind saying what you think is tell like big picture what you're taught in school? And we spoke about this, I remember at CSM, but let's just start there.
Yeah, so big picture, I mean, we're taught a lot of the same things that you guys are in terms of pathology and treatments and issues, surgeries and different things like that. So we're taught in the terms of like the broadness of everything. Like we cover the same sea, like the same ocean as you guys do, but as far as like how deep we go into the material is a lot different. So obviously, as you guys as physical therapists, you go a lot more in depth in terms of the anatomy and the physiology with everything. Um, so, like with the spinal cord, you guys get really down into the nitty gritty of it. We'll go over like the nerve roots, the ganglion, and all that stuff. So we go over it in a broad sense of everything you guys do, but the depth that we go into it is the biggest difference because you guys got to know, as the PTs, got to know a lot more in depth of the anatomy and physiology to be able to do the evaluation and know what's going to affect where and what you need to address than we do because we are doing primarily the interventions or the treatments.
Yeah. And so that's where, so basically what you're saying is you can do the joint mobilizations, you can do the soft tissue mobilizations, the therapeutic exercise activities, and what else am I missing? You know how to
Yeah,
progress them. So,
correct. Yeah. Um, so the first one you mentioned, the joint mobs, like we discussed, that's more of a state to state kind of thing. Like I'm in Kansas, and we can do up to grade 3, I believe it is, joint mobs. Um, but in like Kentucky, they can do up to grade 4 for the PTA. So that's more of a state by state, what they've determined the PTA scope of practice is on there. Kind
okay.
of like dry needling. Some
Right.
states allow PTA to do dry needling, some don't. It's kind of like that
Yep.
on there. So yeah, progressions we definitely know how to do. The only kind of quote unquote stipulation is like we can progress within the plan of care. So if part of the goals in the plan of care is increase knee range of motion, we can progress and do different exercises and things like that to get up to where the knee range of motion is. But if strengthening is not in the plan of care, then we're not going to be doing strengthening exercise for the knee, even if it's going to help increase the range of motion. That needs to be something that we'll talk to the PT. Hey, I think they're ready to go to strengthening to help increase more. Can you add that to the plan of care next time you do a reevaluation?
That's great. So, in language, when speaking with you, say we're working together, what kind of words would I use? And like, how broad can I be? Can I just say, oh, we're working on coordination, strength, proprioception,
Yep.
balance, and control of the ankle from a lateral ankle sprain? And could you, I mean, like
Yeah.
feasibly just go to town and know exactly what I'm talking about and be able to be inventive, or
Yeah.
do we have to get
Absolutely.
specific?
Yeah, so you can talk to a PTA the same way you would talk to another PT. I mean, we go through and have all the same medical terminology
Okay.
that you guys go through. So we know when you talk lateral ankle sprain, when you talk lateral elbow sprain, when you talk hip flexors, knee flexors, we know all of that terminology. We know the muscles for it. We know the insertion, the actions, the origin. So we go through all of that information as well, same as you guys. Again,
That's
it's
great.
just that the depth of it when you're talking anatomy and physiology. Um, we don't go into the depth right there. But if you say, hey, we need to do hip strengthening for to address his knee range of motion because he has runner's knee and he's running on uneven ground, and that's why we're doing it to address it. We're gonna cool, great, let's do it. So we know all the terminology and everything. There, like you don't have to change really how you talk to PTA compared to a PT.
So, and because I'm looking into one day owning my own business and working with a PTA for sure, I was wondering how communication wise, I wouldn't want to be presumptuous when communicating things. How do you know, like, what's an appropriate way to communicate to a physical therapy assistant? I would say in comparison to a PT tech. I wouldn't want to be belittling. I wouldn't want to go over your head. I want like what is that? It sounds like I can speak pretty much the same. I mean, clearly from
Yeah.
what you just said, the same language, but because unfortunately, I've only worked with PT techs. I have not had the pleasure of getting to work with PTAs yet.
Mhm.
I was wondering like how would I get started with that communication to make sure it's like really we're on a good plane, like it's good,
Yeah,
a
yeah,
good partnership.
yeah. So I'm gonna speak to this as best I can. I've only had one clinical so far, so I don't want to speak for like all PTAs and everything.
Totally.
But the same thing that I've talked with and seen other conversations is really just ask. I mean, same thing as when you go into a clinical yourself, your CI asks you, "Hey, do you know how to do this, or have you covered this in school yet?" And if you say yes or no, and then they go on and let you do it. So with the PTA, I mean, general orthopedics, I mean, for the most part, other than like joint moves, like I said, I mean, they're gonna pretty much know what they're doing and how to do it, and they'll ask if they don't. And that's also part of our job description and our scope of practice is like referring to and knowing what our skill set is, and if something is not within our skill set, to make sure we're coordinating with the supervising PT. Say, hey, I don't know how to do this, or I haven't dealt with this diagnosis before. Can you help me out, or can you kind of be nearby while I'm doing this and kind of give me some tips and pointers. So as far as like wanting to know what they can do, I mean, simply ask. If they're a
Yeah,
PTA that's been in the business
collaboration,
for like,
collaboration
yeah,
for sure. That's
exactly,
cool.
communication. That's really all it is.
Yeah, I like that. I like that a lot. Well, perfect. Is there anything else you want to add, Eddie, in this conversation for anybody who's listening that may get confused on the differences and how we can work together? Because I feel like you pretty much said it all really succinctly.
Um, yeah. So like you said, a lot of PTs, unfortunately, when they're in school, they don't have the opportunity to learn or work with PTAs. Their
Yeah.
whole knowledge of it is working with PT techs. And so something I want to be able to distinguish is a PT aid or a PT tech is a physical therapy aid or physical therapy tech, while a PTA is a physical therapist assistant. So our specific job is assisting the PTA in the interventions and treatments of conditions and everything that goes into that. So the PTA is a licensed clinician. We go
Yep.
through school. We take a board exam just like you guys do. Obviously, it's not the same exam, but we do take a board exam to be able to practice physical therapy in the 50 states, whereas a PT aide is not a licensed clinician. So if you're in a clinic where they're only using PT techs and the PT techs are the ones supervising um, patients with the exercises, that is not good. It's not okay. It's borderline fraudulent in some areas as well, depending on who you're working with as far as insurances go. Um, but if you're working with a PTA and 99% of them are going to know what they're doing and they're going to be able to do it really well, just treat them like a member of the team. I mean, it's the same as
Yeah.
like nurses and MDs. If you're in the hospital or if you're really anywhere, the MD is the one that comes in, does the evaluation, determines what areas are going to affect other ones with different pathologies and different comorbidities that the patient might have. And when they make changes to the plan of care, the nurse is the one that comes and does it. So with the bed positioning in the hospital, the nurse is the one that comes in and does it. When there's changes to the medication, the MD writes it on the chart, change medication, and the nurse is the one that comes in and actually does it. So for me, that's my best analogy of how it works is the
That's
nurse and the
great.
MD.
I like that.
But yeah, same thing. MDs don't have to talk differently when they're talking to nurses. They know all the lingo and all the different pathologies that they're going to be working with. And so the biggest thing is really just communication. If you don't know if they know something, ask. I mean,
Yeah.
I would hope nobody gets offended if you ask them, hey, do you know this? I don't know if you've been trained in this. Can you let me know if you have?
I like it. Yep. Communication in general is always key. So that's great. I
Oh yeah.
liked it a lot. Thank you. Thank you, Eddie. Eddie, seriously, for anyone who's ever been curious like I was, where I never, like I told you, I still haven't worked with physical therapy assistant yet. Like,
Yeah.
please, or if you think that this video is valuable, please share this out. This video is really just to give information to others so we can just improve ourselves as practitioners and also as team workers. So thank you. Thank you, Eddie. You're
Yeah.
awesome.
No problem. Thank you.
All
Appreciate
right.
it.
All right. Have a good night, everyone. Take care. Bye.